name because of the community work that I do in regards to mental health and just being the voice for the youth, especially those who are underrepresented.
Okay, fantastic. And Amis Ahmed is a bit modest. She is actually the winner of Africa Youth Activist for 2019. So she's a phenomenal leader. Thank you so much for that. And then next, in terms of the introduction, Dr. Grace Ogihar Inoma. Sorry to butcher your name.
Thank you so much, and good morning, everyone. I'm from New York, and my name is Grace Ogiho Inoma. I'm a nurse administrator, and I'm also a community leader. I'm the executive director of National Association of Nigerian Nurses in North America, and we focus a lot on our community, bringing health information to the community. And I could talk about the experience we have for vaccine hesitancy, even within the healthcare professionals. And also we partner with a religious group, the mosque, the churches, to bring health information and awareness to our people to reduce vaccine hesitancy. I could talk about that as we go on. Thank you.
Thank you so much. Much appreciated. It's great to have you here. And next, I'm going to ask Imam Talal to please introduce yourself.
Well, from my side, I say good morning. I am delighted to join you. And of course, we are talking about COVID-19. The least thing I can say that we need to take this pandemic very seriously. Now, I did hear about some religious leaders, different faiths, who are not really agreeing with the international community. These are minorities. It's not majority. And the majority of imams, they do take this pandemic very seriously. Now, in our religion, when we look at Islam, I can identify two areas here. One area, the saying of the Prophet, tadawaw. And the term tadawaw means seek every opportunity for cure and healing. And the second one is same thing, the saying of the Prophet, that at-tahur shatrul iman. It means cleanliness is half of the religion. So imagine someone who pray and go for Hajj and pay zakat and do all religious obligation. This is only 50%. 50% of the religion is based on cleanliness. That's prevention.
Sorry to interrupt, Imam. So we're just gonna delve a little deeper on these discussions after the brief introduction. So we'll come back to you, and okay. Let me just introduce the next speaker, and then we're going to turn things over to Dr. Nua, and he's going to have two separate panel conversations. So we will have opportunity for all of you to really delve deeper into this conversation. So just introductions, please, and Dr. Adoye Oguntomilade. Sorry if I butchered your name.
Thank you very much. I really appreciate the opportunity to be part of this conversation. Thanks to our co-host and to the entire organization. I am Adeoye John Oguntomilade. I'm an ordained Christian minister. And I've had the opportunity to serve in various ministerial capacities in Nigeria, Mozambique, South Africa, and in the US, in the Washington, D.C. area, where I have been a pastor for close to 20 years in the Washington, D.C. area. In my secular work, I'm a trained dentist with a master's in public health and a PhD in global health, and I've had the privilege to manage multiple programs in many countries in Sub-Saharan Africa and the Caribbean. Thank you very much. I look forward to these conversations.
Thank you so much. Now I turn things over to Dr. Noah, and you have two separate panels, so let's turn things over to you.
All right, so I think that it's really wonderful to have, we have a really distinguished panel today. And so we're gonna start with Imam Taler, right? Yes. And the first question is really, you know, would you mind sharing your vaccination status, and how did you come to the process of the decision either way?
All right, so in the beginning, same as any other citizen in my area, we all were very disturbed with the issue of this pandemic. And like for me, I looked at life around me, and I do see, and I did notice that life has stopped completely. I mean, everybody stayed home, and so life was disrupted. So what I did, I have many physicians in my community who are Muslims. I called them. I started to discuss with them, and all of them, they gave me one word: this disease is very serious. Something needs to be done. So now I put this on one scale, and I looked at the religion on the other scale. And in our religion, as I mentioned, the cleanliness is very important. Seeking healing is very important. Even in the Quran, that at time of necessity, we can break the rules in order to save our lives. So I did not see, same as many other imams in around the US and around the world, we did not see anything suspicious. And like for me, I waited for the first opportunity, and I was vaccinated, the first one and the second one. And now the third one, it will be done in a couple of days. So this is how I voice my concern over those who still believe, for some reason or another, that they have doubt about vaccination. Now, vaccinating, it's not only to protect ourselves, it's to protect our loved one, those whom they live around us. And I am unable to imagine that someone who may be infected, not vaccinated, and then going to see his or her doctor or mingling with people, and they can be carrier, may not be affected, but they will affect others. Especially now we're talking about Delta and the mutilated. So I urge all those who are not vaccinated to give it a serious thought. And I can surely confirm that those who are not taking who are not vaccinated, they are committing a serious breach about their religion.
Wow, that's powerful. And I think, thank you for sharing that. I think that's a really important message, that we should be able to share that to the population, not only to the people that you minister to. Now I'm going to ask the same question to you, Dr. Pastor Adeoye. You mind sharing your vaccine status, and how did you arrive at that decision?
Thank you very much for that. This is a very important junction in history. We've never seen a virus like this. This pandemic has impacted the world and many nations. One of our co-hosts at the introduction talked about the number of cases of COVID and also the number of mortality across multiple nations. This has affected life as we know it. It has affected the way we worship. It has affected the education of our children. It has affected businesses. It has significantly impacted the world. And as a Christian minister, one of our prayers at the beginning or the onset of the epidemic was that God should provide an opportunity to stem the tide of this pandemic. And I sincerely believe that these vaccines that were established are an answer to prayers for us to save humanity. Many times people believe that science and religion are at odds. I personally believe that true science is a discovery of what God has already placed in creation and learning how to optimize those resources. I am fully vaccinated. My family is fully vaccinated. I've been able to look at the vaccine information from very credible sources, and I'm totally convinced that they are safe, they are efficacious, and they would help to reduce transmission. They will help to significantly reduce severe illness, and they will help to significantly limit death as a result of COVID. I see this as a personal responsibility for me to take the vaccine to protect myself, to protect my family, to protect my community. And I see it as a responsibility to protect those that are around me. And I call on my fellow religious leaders to learn more about this, to learn more from credible sources and address their concern and come together as force multipliers to build greater confidence in our circles of influence about the vaccine so that we can increase the uptake of these COVID vaccination to protect our community. So I fully believe that these vaccines are safe, they're efficacious, and I personally have taken it. My family has taken it, and we're doing this as an example for our community. Thank you very much.
That's really powerful as well. I mean, you both, congratulations. It's really wonderful to have religious influential leaders like you who have actually taken the vaccine, and even the imam sharing about talking to their doctors. I think that's really important. So, you've watched that video at the beginning on the misinformation. So how can we address this misinformation? I'll go back to the imam on this.
Well, addressing this may help, but may not. You need to take aggressive measurement. Like for me, I say it is a sin not to be vaccinated. And I stand by that. And not being vaccinated is a crime against humanity. Now, you did say, all the speakers who started in the beginning, they are saying it's serious. So it is a crime against the humanity because innocent people are being affected by the carelessness of others. So I would, turn my voice toward government officials. Government officials, they need to take extra steps to make sure those who are acting carelessly and just spreading rumors and saying something about the vaccine. The vaccine is totally safe as I see it, as many members of the community they see, and